Good morning to you. It's Timika Chambers, NCLEX Prep Coach, and just want to point out a few things on this picture that I use AI to help me create. NCLEX Study Guide or the test plan is so important for you to incorporate that in your NCLEX Prep, that you're looking at what exactly they want you to know. And many of my clients didn't know about the test plan. Your body is important for you as a nurse to see the body, the bigger picture, how the body works together. And then also to EKG. Many nursing graduates still struggle with EKG and cardiac. So definitely want to encourage you to make sure you fully understand the systems and how they work. And look at this cup. Future RN. Do you visualize yourself daily being a nurse, right? And pharmacology is typically one of the hardest subject matters that nursing graduates have a problem with. The great thing about it is that because I was a pharm teacher, I'm able to help people understand that and break down drugs a little bit better. All right, so let's tackle this question. The oncology nurse is performing cancer screenings and is aware that this client is most at risk for stomach cancer. So it's so important for you to read the statement as it is. Go ahead and pause me, and you go ahead and select your answer, read the answers and select. And then you're going to unpause me starting now. All right, so we have an oncology nurse who is performing cancer screenings and is aware that this client is most at risk for stomach cancer. The important thing about it is look at the relationships. What are they asking you about? They're asking me pretty much about most at risk for stomach cancer. So that's the relationship they're looking at, is that who's most at risk for stomach cancer. All right, so I have some ages here. That's that. I'm going to look at that. But I have things that they're doing, eating, right? The 32-year-old who's a vegetarian, the 55-year-old who is binging on 3 to 4 ounces of ice cream once a month, the 40-year-old who drinks 3 cups of caffeinated green tea, or D, and it's important to pick that up, or D, because you're telling your brain, is this the answer or this is the answer? 28-year-old who eats construction worker who eats deli meat sandwiches. And so the answer is, when you look at these, vegetarian, I know they can lack some things. Ice cream, that's not the best. Caffeinated green tea is good for actually decreasing cancer risk, protective nature. And then D, deli meats. I know nitrites are in the food. So it's important for you to look at what the rationales, what's the correct answer and what's the incorrect answer. Incorrect answer we're looking at, or the correct answers we're looking at is D. And what is it looking at? It's looking at the reduction of risk area and